My name is Adrian Bedar. I'm an orthopedic surgeon at Hampton Roads Orthopedics and Sports Medicine. I wanted to talk a little bit about knee replacements today. One of the things I like to inform patients is that there are multiple options available for them when it comes to knee replacement. Knee replacement is an option when they have hit the end stage of arthritis in their knee and no other modalities are working. But one of the options that patients don't realize that is available sometimes is what is called a partial knee replacement. Most of the time in a patient's knee, they do not wear out their entire knee, but just one part of it. I tend to think of the knee as three compartments: the medial side, the lateral side, and then behind the kneecap. The most common thing that people will wear out is that medial side. If that is the only part that is affected, then there is an option of doing, again, what's called a partial knee replacement, where we fix just that medial side, and we don't have to address or bother the other parts of the knee, especially if they're okay, the outside part and behind the kneecap part. A full knee replacement, again, is going to resurface the entire knee. So we're going to remove the arthritis, protect the ends of the bone with an implant that it's like putting a cap on a bad tooth, so that that tooth is protected. For a full knee replacement, that's going to cover the entire joint. For a partial knee replacement, we're only going to address the part of the knee that's worn out. Again, by putting metal caps onto the end of the bone, so on the end of the thigh bone, the femur, on the end of the tibia, your shin bone. You do get a plastic shim, as I described it, in between there. You don't want metal scraping against metal, but that protects the worn ends of the bone, so those nerves that are hurting from arthritis are protected, and that arthritis is effectively fixed. Again, like capping a bad tooth, you've protected those nerves. The nice benefit about a partial knee replacement is that this is a much smaller operation than a full knee replacement. I like to describe it as 1/3 of the operation. The other benefit is that it's 1/3 of the recovery. So a total knee replacement, while it's an excellent option in the right patient, does require several weeks of physical therapy and rehabilitation to recover from that. With a partial knee replacement, we almost need no physical therapy. Patients, after a couple of weeks, are walking fairly normally. They're off of walkers, they're off of canes, they're moving around very well. Most of them have finished physical therapy at that point. So in 2 weeks, they're doing very well. They're still having a little bit of soreness, they're still getting over it, but in 2 weeks, they're at a point where they would have been 2 months with a total knee replacement. So it's a much easier recovery, and this can avoid ever needing a knee replacement. If the knee continues to wear on the parts that haven't been addressed, though, this does not burn any bridges. You can still convert this to a total knee replacement. In one way, you can think of this as a temporizing measure. It's buying us time before a patient would need a full knee replacement. So in younger patients, that's one way to think about it, as a way of keeping them from getting that full knee replacement for a longer period of time. In my experience, these can last many, many years. A full knee replacement will typically go 15 to 20 years. In my experience, these partial knees get very close to that. So they can last a very prolonged period of time and keep someone away from that bigger surgery until they really need it.